our website. Tonight we're talking about hormones, symptoms, therapy options, foundational things for good health, regardless what age you are, female, male, perimenopause, PMS, young, fit, to stay that way. All right, so next page. So when we talk about hormones, most people really, sort of like even last night we were talking, where hopefully we did a good job explaining more of what neurotransmitters are made of or what they are. But it's the same with hormones. Because people say, yeah, I have a hormone problem. Well, what kind? Thyroid's a hormone. Vitamin D's a hormone. Estradiol's a hormone. Cortisol's a hormone. There's a lot of hormones in the body. Insulin's a hormone. And I always say when one goes wrong, they will all go wrong. Always. It's just a matter of time. It could happen in 6 months. It could take 10 years. But they rule our body. And hormones can be defined as proteins. What did we learn last night? Are proteins important? Do they make every neurotransmitter? Are they one of the most important macronutrient if you're 50 and older? Are they most important macronutrient if you're young and you want to stay super fit? They are. So it's really important. So here we again, even hormones can be proteins or peptides such as growth hormone or small molecules such as thyroid or steroids such as cortisol. So go ahead to the next page. And what they do is they're in the blood, urine, and saliva as well as within the cells. So hormones are made in one cell and act in another. So they're a messenger. There's keys and locks. There's ways to open the door. The door might be open or unlocked, but you've got to be able to get through the door. So hormones really dictate a lot. Go ahead. So before we talk about hormones, I think it's important to understand why, and this is male and female, and all of us have male, females, all ages that we love and care about. So it's really important that we bring in why do we want to talk about this. Because for some reason in the United States, we think illness is normal. It's not. And with women in particular, at time of menopause, a woman's average age after that is 32.7 years. So hopefully you want quality, right? I always talk about well span, not our health span, not a lifespan. 1 and 2 will have an osteoporotic fracture. In fact, on the way here, I said, uh-oh, I saw a patient name pop up in my text. And Ken said, what happened? Because he's part of the practice. And I said, this woman never texts me. It's bad. And sure enough, she had a fracture today. So, and I don't know what yet. I said, I'm sorry, I'm walking to a lecture, but I will call you tomorrow morning, you know. So 1 and 2 will have a fracture. 1 and 2. 1 and 3 will have coronary heart disease. 1 and 5 will have stroke or Alzheimer's or dementia. And 1 and 8 will have breast cancer. So our hormones do affect the quality of our life and our wellness. For men often do not take care of themselves at many ages. And it's really important, and I wish yesterday when we were talking, you know, you're going to see if you come to our lectures, I think we only have a few people that have come to all 3, and Sherry is going to be able to repeat a lot of stuff, but they start to all correlate. It's really amazing because when we talked about men, 82% of men say they want to stay healthy to live longer for friends and family who rely on them, but only 50% engage in any preventative care. So there's a disconnect there. Over 40% of adult men in the US are obese. Over 34% are overweight. Men are 4 times more likely to die by suicide than women because they're much less likely to have help. Because think about women. A lot of times we're more community. We'll tell a stranger if we're having a bad day and they're asked, are you okay, Mary? I know I don't know you, but I see you're crying. Are you okay? And you'll say, no, I'm not. But men often don't have that social connection. Or they're talking, but they don't relate those things. Their biochemistry is also different. When they have certain neurotransmitters are low, it's often worse than it is for female. But again, they're less likely to get help. We also don't ask the right questions. You can't ask most men unless they know they're really sad or someone around them knows there's depression or severe anxiety because it's more apathy. They don't want to do the same things. They don't share the same way. So we have to get better at asking these things. 41% of men were told as children that men do not complain about health issues. Now, we got to do a better job as parents. It's not complaining, it's reporting, it's discussing. Even the word complain bothers me in this sentence when I kept reading statistics. Again, even that word, it's not complaining, right? You want to be able to go to a parent or an aunt or a mentor and say, something's wrong, I'm in trouble here, you know? So, and then 20% of men admit they are not completely honest with their doctor, all ages. So it's not just women, okay? Go ahead and go on the next page. So then when we talk about men as they get older, andropause tends to happen 50s and older for men. Women, it's 30s and above now. Used to be 50s to 60s or above. But because of our stress, because of changes, it's getting younger and younger. So when we talk about andropause, which just means a man starting to have hormones that go down, like testosterone, and women's hormones that go up, if you heard my lecture in Monday, it's that men become more like women and women become more like men. Not just biochemically, but also shape and so on. And we have to laugh about it, right? But when we find out there are biochemical factors to that, that's when it's not so funny, like the progression of cardiovascular disease is absolutely related to getting older and changing hormones. So it's really important. Okay. So when we're thinking about this today, I'm going to bring in just a few facts that just help you make sure you're thinking about yourself. And then, again, asking good questions. Because you want to test, not guess. You know, and always the example I use, only because it's a hormone example. And it's so ridiculous. I don't care if someone's a layperson, if they're a specialist. They never say, oh, yeah, that's wrong. Is that if Karen said, you know, Valerie, I just haven't been feeling well lately. I have, you know, frequent urination at night. My mom's a diabetic. My sister's a diabetic. My husband's a diabetic. I'm pretty sure I have diabetes. I do not say, oh, Karen, here's some insulin. Go see how you feel. Right? Would anyone do that? Do you think any doctor would ever do that? Never. They'd always make sure you have a glucose meter. They test your blood sugar. They look at your hemoglobin A1C at least every 6 months. It's supposed to be every 3 to 4 months, by the way. But you know, they would do that. But every day, women and men are given hormones by how they feel. That's craziness. It's the same craziness. You've got to look at all the hormones that are affecting those symptoms to address it right. So test, not guess. Treating symptoms. Are you treating symptoms that are localized, like something like vaginal dryness or depression or bone density? Right? So they're different things, right? No one feels their bones are going to break. You know, you may feel like you're weak or you're unstable or imbalanced, but you don't say, oh, I think my bones are weak today. I'm going to have a fracture, right? Right? You know, it's the same we talked about at the lecture with the brain lecture. You don't say, oh, up, my cholesterol's going up today. You don't know. So when you start to relate it to other things that are typical in regular medicine, you get more excited about understanding that you want to know what's going on in your body so you can do better. So it's important to know, is it a symptom, is it physiological, or is it something that really we want to make sure we're testing, okay? And then take bias and emotions out of it. We have become an incredible society if everything is about emotion. And I mean on every topic. It has to stop. We have to treat people like every person is just as important as every person, and especially in the medical field. So we have to take emotion out of it. Like, well, Mary Ellen would just do this. That's not helpful to Mary Ellen. It would be, what's going on, Mary Ellen? Tell me what's happening. You know, what else could we do to help support you? What things are you experiencing so we can figure out what the best test or the best treatment is for you? That does not happen in most places. So you've got to make that happen. And if you don't have a clinician like that, then you've got to find one, okay? What are you afraid of? It's interesting that people have all these biases because of Instagram and TV and gossip, that they're not basing a lot of their choices on facts. It's based on emotion. Or they're afraid of breast cancer. Or their doctor or family has negativity. Oh, you shouldn't do that. Well, I wouldn't do that. It's like, well, each person has to be treated individually. Each person has to assess what's going on. I have 2 sisters from the same parent. We are nothing alike. I mean, I really thought I was adopted when I was younger. I'm serious. Thank God they turned out to be wonderful adults. I'm not joking, but I mean, they were terrible. And I'm like, how can this be the same parents? I'm like, I don't understand, you know? And they turned out really nice people. But from the time they were born until they were about 25, I really thought I was adopted, you know? So I mean, so again, why would my sisters and I need the same things? Why would we need the same food? You know, that's why we're not attracted to each the same spouse, right? Because we have different personalities, we have different needs. So it's the same with medicine. Try to support the person and help them ask good questions and get good facts and individuality. Then they can make a good decision, okay? And then what are the risks of not attending to your hormones? In 2002, the Women's Health Initiative came out that destroyed women's health for the last 25 years. Destroyed it. It was misinformation. Most of them have issued medical apologies. They said that all hormones cause breast cancer, increased stroke. It's all wrong. Most of the gynecologists that I've worked with have always done hormones correctly. We didn't care. They were wrong. And we knew that because we'd all worked with thousands of patients. Because I was working with people at that time in a compounding pharmacy that were examining men and women. So I could be sure things weren't changing wrong inside their body on top of the tests. But we came out saying everything causes cancer. Hormones do not cause cancer. Even if you have estrogen receptor positive or other things, that didn't cause the cancer. It has to do with receptors and pathways. Most breast cancer surgeons that are well studied say low hormones cause cancer. I don't believe that is what caused cancer, period. It is when you look at, just like when we looked at Alzheimer's and Parkinson's and dementia, we're looking at, right, insulin resistance. So it has to do with our hormones and diet and exercise, as we talked about for the last 2 hours last night. And the second was environmental toxins. It's the same for cancer. We just had someone that we had talked to that had zero risk, every genetic test done. She had breast cancer, 0 in the family. And they just said, well, we don't know why you got cancer. Because they don't look for why, right? And then she got it again, even though she did everything the doctor said. And that's where she said, okay, time for me to learn other things, because they're obviously not right. So we have to be careful of what are we afraid of. And if you don't attend to your hormones like insulin, like thyroid, like estrogens, like testosterone, you are going to have medical problems and symptoms, okay? So keep those in mind. So the best way to test hormones is saliva. And I believe that's one of the questions on your quiz, just so you know, in case quizzes help you. The reason I always do these when I do smaller lectures is I find people learn better. So number 1, a woman's biggest risk of losing quality of life after menopause is a fracture. Saliva, and then on the next page is urine. So I should have given you both slides before I said the quiz, but I'm going to give you the answer. Saliva and urine are the best ways to actually assess hormones. But you also have to make sure you assess the right ones. Most people get 1 or 2, or they get 1 symptom, or they are tested 1 estrogen. And again, if you're going to take anything, if you just want to test to know and you're not going to take any kind of hormone, then test what you want. But if you're going to do it right, you need to know all of them, okay? Because saliva shows the free active levels that affect you all day, night and day. And most people are on pharmaceutical medications, even if they don't admit it. Most people are on crappy supplements. They bind things. So when you do blood, it's last on the list for some hormones, like female and male sex hormones. Saliva's first. So go to the next page. Second is urine. And urine, we look at free cortisol, free cortisone, and melatonin. Melatonin is not for sleep. It is according to TV. Okay? And it's a shame because now we're seeing infants and children begin melatonin. That is absolutely crazy. I mean, melatonin affects the pituitary gland, and it affects aging, and it affects all hormones. 2017, the Nobel Prize was won because they showed melatonin affect aging, insulin, all these things, cortisol. Hear hormones? Hear hormones? What is the number 1 cause of heart disease? Insulin resistance. How many people had insulin resistance? Do you guys remember from last night? Anyone here? 93% of every American has insulin resistance. That is the number 1 cause of most brain conditions as well as other hormone issues. So melatonin is used and has to be tested properly. All right? And I'm going to show you other reasons why quality matters and give you an example with melatonin with the biggest tennis player in the world that just won Wimbledon. So next. So then we move into, okay, so now you're kind of hearing about how to test, but why are all these things happening? Right? Why are all these things happening? Why are we having menopause and testosterone and young men having trouble with testosterone, with depression, with all these things that are happening. And it is because of stress. Stress is one of the hugest things. And stress isn't if you're happy. This is always hard because when I interview people or we have intake forms, they'll say, I'm not stressed, I love my husband, I'm happy, and I'm retired. And I'm like, that is not what we're asking. Do you have biochemical stress? Are you on any pharmaceuticals? Do you know if you have toxins? Do you use lotions? I was just listening to a podcaster that she's like, I'm so proud, I'm putting estrogen here, I'm putting it on my face, I'm putting it here. And I'm like, you should not be on any podcast. My God. I mean, it was someone pretty well known. I was shocked. I mean, I'm going to have to reach out to her. I can't let that one go. I'm like, are you kidding me? You know, I'm like, holy cow. So there's all these stressors, right? So we've got mental stress, physical stress, including poor sleep. We heard last night how infections are on top of the list for Alzheimer's and dementia. Doesn't matter if it's a urinary tract infection, a diabetes infection, if it's a toe infection. It's very stressful to systemic inflammation in the body, okay? Stress can cause infection. It's fascinating. Cortisol gets too high, it can cause a dysregulation of insulin, and then it affects carbohydrates and glucose and how it affects your blood sugar, even if it's not too high. So all these things, trauma, from emotional to COVID to shingles to food poisoning. Glyphosate. Glyphosate we talked about last night. At the end, we had some people came up because I've never had a cancer patient ever not have glyphosate off the chart. Why isn't anyone testing? Before or after people have cancer. It just floors me. They show, even in research, it's 50% responsible for all lymphoma, all ages. It's a simple urine test. It's just not right. But if you don't know about it, how are you supposed to know how to be healthier, right? So toxics exposures, glyphosate, mold, metals, medical testings. You can look up from Harvard, just regular, traditional, look up. Are there risks from MRIs, CAT scans, and x-rays? You bet there is. It causes cancer. We have more x-rays, MRIs, and CAT scans in this country than the whole world combined. We're not supposed to have one every other month and every little thing. It's so they can diagnose to get you surgery. And I'm not saying you shouldn't have a test if you're in trouble, please. That's not what I'm saying. But you've got to know this because you don't realize. Kent was just saying that he just can't believe the last few years how gadolinium's off the chart. So it's not just MRIs. Now people are getting injections with everything. Even when it's a mild situation, it's a nuclear element that doesn't go out of your bloodstream. Does anyone think a nuclear element is healthy for you? Okay, I'm just checking. All right. So digestive, malabsorption, biochemical, high blood sugar, metabolic syndrome, food allergies, sensitivities, prescription medications. Every vaccine, any injection, flu shot, Botox, any injection has metals, all of them. You can look it up in the CDC yourself. You'll see mercury, you'll see this, you'll see that. Metals are dangerous. Everyone knows lead poisoning. They wouldn't let children have lead poisoning, right, in the old days. So very important. Nutrition, non-nutrient dense foods, fast foods, junk foods, energy drinks, crap out there. And then severely wrong or not enough nutrition foundation in the vitamin D, the essential fatty acids, and the phytonutrients. And then one we cannot control. Here's one you get a break on. We're all going to get older. I don't care how you look. I don't care what you do, what you believe. We cannot stop aging. We can only slow it down. So I had someone at one of the first lectures I said, well, I'm just going to test and then test a second time, and I probably won't test for a few years. That's what my doctor said. Are you crazy? Did you get older every year? Is anyone in this room, and we're all over, except Bryson, but he's not here now. Yeah, all over a year. All right, so Bryson gets a break. So Bryson, you're up. But if you're over a year, are you the same? Think about an infant, right? Bryson is how old?
He turns 8 months tomorrow.
All right, 8 months tomorrow. So from birth to 8 months into 1 year, is he a little different?
Sure.
How about you? Do you think I act the same as I did when I was 15? God, I hope not. I remember once laying on the ground crying. My mom asked what was wrong. I don't know. Like, seriously, I feel so bad now. She said, oh, you were the easy child. I'm like, oh, I'm sorry. You know? Okay. So a lot of stress. So that's where I want you to understand it's not if you're happy or have a good or bad day. It's nothing to be ashamed of. We're multitaskers. We're hit with a million social media. I mean, I'm amazed that every other person's phone is not, you're looking at your phone. I mean, right there is unusual, right? I mean, we can't even just relax. So it is, we have to be willing to look at these things. These are part of why our hormones go out of balance and why we have disease, okay? Next page. So, and if you're male, we have to start looking at first, what are some of the symptoms? Any age now. Even when you're not in andropause, which means your testosterone's going down because of age, it can go down because of stress. It can go down because of pharmaceutical medications. It can go down because you're not exercising enough. So tired, increased irritability, decreased libido, changes in sexual performance, increase in abdominal fat, loss of muscle strength, increased lipid levels, disrupted sleep, rising PSA that shows up. PSA is a great example with men, why so many men come to see me. They come and their PSA is 3 and their doctor says, oh, it's no problem. I'm like, you're crazy. If it's over 1, you've got to watch what your pattern is. They will not say a word until it's 4. Then they want to do surgeries, biopsies, and everything else. They do nothing until it's 4 and already a medical problem. You have to track your PSA from the first time you ever get it done, hopefully a young man between age 20 and 35, so you have on what your norm is, and then every year after that. And if you start, like I'll see men for years, 0.5, 0.5, 0.5, 2. Like, uh-oh, something's off. So there's no, you don't have cancer or a prostate problem yet, but that can go from 2 to 4 in 1 year, in 6 months. But nothing is said until it's 4 and above, okay? And then there's nothing they offer you but drugs and surgery, okay? So PSA is a really good example for men. Urinary changes, flat, less motivated. This is happening in all ages now. It's not just andropause. Hair loss. Do you ever look back? Like, look at old movies. My mom just turned 81, and if you watch, she loves black and white movies, right? You see any of those movies? There's only usually one person that's missing hair. One person. I mean, for weeks, if you watch black and white movies. They're thin. They all have hair. These are a lot of reasons for all these things. Our poor diets, all of our things that are happening. And then, of course, increased risk of cardiovascular disease and lowered immune system. So hormones are really important, and these are some of the men's symptoms. So the adrenal glands affect everything. So the adrenal glands are glands located above your kidney that respond to stress. So again, not just if you're happy, right? Medical stress, car accident, emotional stress, any kind of stress. But the adrenals are what give you your resilience. And what's happened is because we're so stressed, even our children are stressed. Ask a child that's 4, yes, I'm stressed. How do you feel? I'm tired. I mean, why is a 4-year-old saying they're tired? Unless they've run around for 5 hours. Okay, then they're tired and they just drop, they sleep, and then they're fine again, right? But it's an epidemic. And what's happening is our adrenals are so overstressed from all of this constant stuff we just talked about, they can't give you 50% of your hormones as you get older. Or you start burning them out even younger. And then there's anxiety disorder. And then there's depression. And they affect every organ system. Inflammation. Remember, we talked about inflammation being the top 3 for brain health. Doesn't matter if it's anxiety, ADHD, ADD, depression, all of it. And then, of course, it's what turns all disease on, including cardiovascular disease. Then we have musculoskeletal. Well, we're worried about bone, muscle integrity. What about metabolism? Weight, body fat. You can have high cortisol or low and have a big stomach. It's ridiculous with TV. They just believe everything's high cortisol. It's absolutely not true. Sometimes people with low cortisol, you can't metabolize carbs, protein, or fats properly. Well, then what are you supposed to do? It's like no matter what you do, you can't win, So then it affects detoxification of the things we just talked about that are so important. That is number 2 for Alzheimer's and brain conditions. If you don't have the adrenal glands, they can't detoxify properly. Neural tissue, memory, learning, sleep, moods, right? Every other person has ADD, ADHD. It's not true. It's that we are people can't even focus because they're on their phone, they got to read, they're on their phone. I mean, even driving, think about it. We don't even get a break when we're driving because of GPS and everything else, right? And then you hear a text come in, So we have to learn how all these things affect us. So the 2 main adrenal hormones are called DHEA, dihydroepiandrosterone, and cortisol. Now, the adrenals do make a little bit of other hormones and neurotransmitters, but the main ones are cortisol and DHEA. Those always should be tested with female or male hormones, unless you're any age and you just want to start with your adrenals. Then you have to test 4 cortisol by saliva and 1 DHA sulfate for it to be accurate, okay? So go ahead and go to the next page. Thanks, Ken. So DHA, why is it important? It has multiple immunology roles and cardiovascular. And there's lots of research. One of the things here is, like, if we talk about it, transcription of genes, fat metabolism, mitochondrial activity, inflammatory, autoimmune conditions. I mean, I can go on and on and on. And DHA lowered levels are associated with diabetes, dementia, cognitive clarity, erectile dysfunction, reduced sex drive, reduced muscle. DHEA does not increase testosterone in men. So I do a separate slide when I do a men and women video, because DHEA can be tested without testosterone for men and given properly. And the average man needs between 5 and 100. But there's also what kind you need. It depends on what your levels show and your symptoms, if you need a liquid, if you need a capsule, if you need a cream. So even there, it's really important. Dr. Norm Shealy is a neurologist, an MD, then he became a neurologist. And he said if there's one hormone you should test outside of vitamin D, any age, especially over the age 25, it's DHEA sulfate, because it impacts the brain. Even in psychiatry journals, it's responsible for anxiety and depression in 50% of cases. Why the heck aren't people testing this? Someone's getting counseling and they're getting regular counseling. They're going and they want to get better. Why wouldn't we help them get better, right? And so it's super important. So remember, with men, the main difference, it does not influence testosterone. Okay, that's a good thing. You're lucky, because we can give DHEA and it's very inexpensive, but with the right test. Go ahead and go to the next page. But with women, DHEA directly influences testosterone in 99.9% of women. So if you take DHEA and you don't know your testosterone, you could hurt yourself. You could cause high insulin. You could cause testosterone problems. You could cause ovary issues. You could cause vaginal bleeding just from DHEA. So you have to know both, okay? If I have someone that's very, very stressed and they only can afford the adrenals, where they look at cortisol and DHEA and it's a woman, I never, ever give her more than 5 to 10. And I also make sure I know what prescriptions they're on or not on, to be very careful with it, because it absolutely increases testosterone. This is good some of the time. But at any age, women can have too high a testosterone or too low. Everyone thinks they all have too low after menopause. It is absolutely not true, okay? And DHEA, women ovaries produce half of the testosterone. DHEA increases testosterone in women. It affects well-being, bones, muscle, libido, moods, cognitive functioning, oxytocin. Oxytocin is something that you can produce yourself. Brittany would have experienced it with Bryson. When you're pregnant and give birth, there's a natural hormone that's released, oxytocin, that's a feel-good. There's very few ways to produce that outside of birth and pregnancy, outside of things that we all should be doing. Exercising outside, being outside, laughing, right? All these things that produce happy feelings. Smiling at somebody, giving them a hug. You know, it's really amazing how oxytocin has a real effect, especially on women, because we naturally have a way to produce it because we're able to have children. So that's why emotionally it's really important to listen to beautiful music, go outside, laugh with people. Don't always be too serious. You know, someone doesn't have their smile, my dad always said, give them yours. You know, I did an experiment once when I lived in Lakewood, Ohio, because one of my friends said, they're so unfriendly there when you walk. So I used to walk with when I moved there, I walked there with my kids in the running stroller, and all I did was go by, hi, hi. And you know, by the second week, people would on their neighborhood and be out on the porch, hi, we were wondering if you're gonna come by today. I'm like, see, people are friendly, right? I mean, you know, we got to do better about raising these things, because it does make a difference in our life. What if that person's had a terrible day? That might have been the only person they had someone say something nice to them, you know? So it's really important. Men, the testes produce most of the testosterone and really has 3 huge influences, all ages, on muscle, erections, and motivation. So very important, okay? All right, next. So DHEA, people always ask me, well, what kind of therapies? DHEA is available over the counter. Don't you dare buy it. I'm just telling you, don't you dare. I was shocked when I started running a compounding pharmacy and I found out you could go get it at GNC or stores. Are you crazy? And we wonder why people have illnesses? It is a hormone. How do you know how much you need? What kind? There's all these different forms based on the person's history. So do not take DHEA. 97% are contaminated and have unauthorized hormones in them. You get them from someone like me or someone that knows what they're doing, okay? Please. All right, next page. So then when we start talking about adaptogens, we're going to start, nope, this is out of order, so I apologize a little bit. So adaptogens are things that help your body adapt to fatigue and stress. There's some adaptogens you can take without any testing. When I worked with a lot of people from NASA and surgeons, they don't have regular schedules, you know, or a new mom. Sorry, I don't care how wonderful life is, it sucks sometimes with, you know, not feeling good, not sleeping, not regular schedule, you know, body hurting, all that stuff. And so when you don't have a regular schedule, adaptogens can help your body adapt to fatigue and stress. So regular adaptogens in the right form, the right kind, can be very helpful without testing. But I always tell people, if I give you an adaptogen for a few months and you're not feeling better, please, you need to test your adrenals. Don't keep just taking them, okay? Because there's all different kinds. Then when we know there are kinds that do increase cortisol or do lower cortisol, how do you know what they are? Many adrenal symptoms mimic high or low. Cortisol also changes as the day goes on. You could be perfectly fine in the morning and have super high cortisol at night that causes anxiety disorder, or OCD, or rumination, or multiple night wakings, but it's perfectly fine during the day. You think you want to take that in the morning? You know, so you have to know them. So there's a lot of different things we use, and even with men, there's also hormones that work really well and herbs that will increase testosterone by 50%. So if I can, I try to use herbs before I use injectable testosterone or a bioidentical with a man, because it enables your body to work at its highest function, and we make sure the adrenals are working. So there's a lot of different things. The reason I put this one up here is this is probably 1/10 of what I might use when I test someone's just adrenals. I'm not even talking about their female and male sex hormones yet. So do you see what I mean? You don't want to just go pick something. You know, please make sure you ask an expert, okay? And an expert in hormones is someone that has tested over 5 years and thousands of patients. Otherwise, they should be honest and say, I really don't know what I'm doing. I mean, even the first 3 years in a compounding pharmacy, working 60 to 80 hours a week, every patient that come in, I said, I just want you to know I'm still learning. And I went to 52 medical lectures and advanced trainings in 3 years. And I really felt like I didn't know what I was doing for about 5 to 7 years. And people dabble in it. That's crazy to me. Most of my patients that need hormones, half are specialists themselves. Endocrinologists, gynecologists, even the ones I used to train, they don't have time to do it. They have to do exams and surgery and deliver babies. They don't have any training in it. So they come to me for that, so I can monitor and do that. So you have to ask the right person the right question. Even an endocrinologist is a specialist in hormones. They usually know nothing about adrenals. They'll say there's no such thing, except for 2 adrenal diseases, which is diagnosed by saliva, then urine, by the way. Yeah, so really important. So there's a lot of things you can do, and there's a lot of things you can do before you use prescription forms. There's some really wonderful things that are not expensive that work really well. So when we talk about cortisol, this is one of the questions, I believe, should be. Cortisol is the other main adrenal stress hormone. Why is this important? Okay, so you want to make sure you put in, you know, number 3, what adrenal stress hormone affects men and women's bones, blah, 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 DHEA. What are your 3 top stressors? Because they're different now than they might be in 6 months. They're different now than when you were 10, right? They're different now than when you were 40, okay? right? It's just true. So, and then number 5, this adrenal hormone, cortisol, is a biomarker of mental disorder severity. Again, I don't understand why we're not testing it when half the world has anxiety, or half the United States has anxiety or depression. So why aren't we helping people with the biochemical besides the counseling and the community and all the other things we need? So again, this is a 2021 study. I can give you study after study. So it's not new information either, okay? All right, go ahead and go on. So cortisol, so again, cortisol affects a lot of different things. It can be high or low. It can affect things like anxiety, sleep disruption, falling asleep, rumination, jitteriness, even tremors. Low cortisol can affect energy, depression, apathy. Very important, okay? And there's all sorts of herbs and things we can use, and they're in different classes. So again, when I use things like combination products, I only use those when I test. But when I use things like, let's say, Mary, just if you don't mind, Mary just says, you know, I just don't know if I want to test yet, and I'm having a lot of anxiety. And I'd say, you know, well, when you're ready to test, this is what I'd recommend. There's only 2 things I could recommend you do besides nature walks and breathing, and I could teach you some of those techniques or that kind of thing. But there might be something like L-theanine, relaxation. You can use it in a 2-year-old or an 80-year-old. It works about 50% of the time. So there are things that we can recommend that might help, but if it continues, then I say, are you getting professional help? Are you looking at what your stressors are? Can we make sure we know what's causing it? Because if I went up to Thea and said, oh, Thea, you've got like 10 Band-Aids on your arm. Do you have a new kitten? She's like, no. And I'm like, well, why do you have Band-Aids? I don't know. I just thought my toe hurt, so I just put some Band-Aids on and see what would happen. I mean, you'd all think she's nuts, right? But that's what we do with medicine. Oh, you're having the symptom? Let's throw this at you. You see what I mean? Sometimes the more examples you have, the more you can ask better questions or decide how to address a particular imbalance or issue, okay? So there's all different things, but most things that we use in our office are with testing because we really like to match what matches your symptoms and what your results show. But if you're in trouble, you know, there are a few things we can use based on symptoms that are safe. But again, it's because I've used them a long time and can. Okay. Luminate is something that's fabulous for the adrenals. When it came out, I was very skeptical. I am very picky. I also want to make sure things are tested. Luminate has adaptogens, and the ones that are safe to use, short-term or long-term, in small amounts. I've used all of the ingredients for 30 years, so none of them are new to me. But if I had the Luminate and I gave it to you in the pack, you could put it in your water bottle, have it right now and drink it. If I gave you the things in Luminate, I would have to give you 8 different dietary supplements. It would be very expensive also. And so what's really nice about it is it's got different adaptogens. It has the coffee berry, so very low caffeine, but the kind that doesn't typically cause jitteriness or sleep problems. And it has some other herbs and nootropins. We talked about the nootropins a lot last night. Nootropin is something that helps with mental enhancer or clarity, focus, memory, so on. So again, instead of a Red Bull or a coffee, there are other options that have other things that help with the adrenals and resilience besides your energy. Okay? I am, as I mentioned last night, I know a few of you here last night, my nickname has been, anywhere I've lived, and I've lived in many places, Energizer Bunny. And I'm still the same way. So when it came out, I'm like, I don't need this, you know, right? Last thing you want me is more energized, you know, probably, or at least my husband might say that. But you know, one of the things that happened is I'm a big workout person, you know, and I'll be 59 this year, and I've done bodybuilding shows, marathons. I'm very active still. Average workout is 1 to 2 hours every single day. And when I added this and the superfoods, which we haven't talked about, but I'll just say, my workout went up for the first time, and my performance and my strength the first time in 5 years. I was really surprised. I was not expecting anything. I just wanted to see how it worked. Did I have any benefits? Did I have any side effects? I'm very good focus. I can do any project and get it done. It's just my way. It's just because I'm passionate about so many things. But most people really, I would say about 90% of people feel a difference even after the first time. And if you don't, and you take it for 1 or 2 months, you will notice a difference. So it's really nice that there is something pretty simple. My husband takes his in a warm glass of water in the morning, like when he goes to work, and then he has one in the afternoon because he gets very tired in the afternoon, and it's wonderful. He doesn't do tea, coffee, anything anymore. And his adrenals, the last 2 times I've tested him, I haven't had to do anything. So it's maintained his adrenal glands really well, where he's usually up and down based on his work. He's a financial advisor. And before that, he was a professional athlete. So a few of you, only Sherry got to meet him at the lecture on Monday at a gym. So, all right, so let's go to the next page. So why are hormones important before we start talking about testosterone and estradiol and estriol? Because every single hormone is a steroid. Now, steroids could mean something like a bodybuilder to one person, and someone else could think steroid as an inhaler. But all steroids have serious side effects, and all steroid molecules, including cholesterol, is a steroid molecule. So is estradiol, so is progesterone. So your hormones influence your lipids. So if I have a young woman that has to have a hysterectomy, their cholesterol might be 150, and after hysterectomy it might be 300. I can't tell you how many referrals I get from doctors, and they say, quit eating butter and cookies. She's like, I didn't change my diet, you know? But her hormones went in the tank or were imbalanced, and the lipids go up. So these are all metabolic pathways. How many cardiologists have you seen that asked you about your hormones? I've never talked to a single woman that has told me that, or a man. It's just wrong again. So do you see why I said in the beginning hormones are so important? If heart disease is still the #1 killer, and it's insulin and hormones, not lipids, there's a problem of how we're doing things, right? So really, really important. So we won't go into the receptors and the pathways, but I want you to see this. This was a better picture than most. Usually they're really complicated. And you can just see where some of these things we've talked about are already in here. Even cortisol, right? Isn't that amazing? So again, your stress that influence cortisol could influence your risk of heart disease and influence your cholesterol level, your lipid sizes, and your inflammation, because they're all steroid molecules. Okay? All right. So that wasn't too scary, right? Did I do okay on that one? It's the only slide in here I was like, oh, I got to keep doing better. Okay. All right. All right. So there's 3 estrogens. So my beef, and I apologize if I was, to someone that said to me, I'm on estrogen. Which one? Nobody knows. You need to know what you're on. There's 3 estrogens in the body, all of men, women, and children. All of us have 3 estrogens. It's not estrogen. We have 3 estrogens. Estradiol. Most people are given estradiol for everything. It's birth control, vaginal dryness. You have depression, they give you estradiol because it has over 400 functions in the body. Okay? Then there's estriol, which is actually more like 80% of the body after menopause that affects vaginal changes, pain, urinary changes, and UTIs. It also directly affects bone density. And if bone density was the biggest risk of women up there, remember 1 in 2? And do you know that out of 1 in 2, let's say 2 people, the one that has a fracture, that's the biggest risk of getting in a long-term care center? And also then 25% of those have a biggest risk of dying within 1 year. Yeah, so really bone fractures are a huge problem because of the cascade of things that happen. And so we know there's 3 estrogens. There's different kinds of estrogens. So when a doctor says they're all the same, even when I used to do in-services, I'd say, really? So here's estradiol, and I don't have all the molecules up here, but I'd say, well, this is, okay, estradiol molecule that you're giving to this woman in this synthetic patch, and then I'd have this one, and here's the one that's in our bodies naturally. Do they look the same? They'd be like, oh, I forgot. They're not the same. So there is a difference. Now, I am not saying that bioidentical, you should just go get a bunch. Because if it's not matched to your body, if you take too much, if it's not tested often, you're putting yourself at risk too. It's not that bioidentical is safer. It's that it matches the body better and it can be adjusted better. When I was at a lecture on Monday, one of the women came up to me and she said, I'm just mortified. I've been to 4 clinicians And every clinician wanted to put me on the same thing. How can I go to 4 clinicians and they're all putting us all in the same thing? I said, I know, it was probably Biest, testosterone lotion, and 100 or 200 milligram progesterone pill. She said, oh my God, how do you know that? I don't even live here. I live in Florida, right? I don't know what doctor she went to. It's wrong. It's not tailored to the person. It wasn't tested properly, and she doesn't feel well, you know? So there's all these different kinds. Okay. So this is something that we're working on getting changed, because this is an example of one of the things that has really destroyed and made men and women and doctors afraid, because they put a black box on any kind of estrogens. Now, to say that, it is the synthetic estrogens. And synthetic estrogens, in my opinion, are not the first choice. I've put 2 people on synthetic estrogen in 30 years. That's because nothing else worked. Both had brain cancer. So I think they just had such, no matter what we did. And I worked with their oncologist and their doctor, because that's a very serious condition, as you can imagine. But estrace, all synthetic estrogens have black box warnings, which mean they increase the risk of cancer, stroke, and heart attack. Again, when they looked at the studies, it's again because they're giving it to people. It's the wrong form for the wrong body part. The second thing is, again, it doesn't match the receptors in your body. And third, most women are not tested, and if they are, they're blood tested. So again, a lot of the people like myself and the gynecologists that have been doing this correctly for years, we're trying to get this removed, because it should be on every hormone. That should say more like, were you tested properly? Were you individualized, right? And when you take bioidentical, we can match it. You could be on 1 milligram. If I had to give, Darlene progesterone, she said, I'm not sleeping, my progesterone's low, I've had a problem before after pregnancy. I said, oh my God, I measured it, is really low. Okay, here's 100 or 200 milligram. Where I could give her a topical that would be 5 milligrams. Why would I give her 10 to 100 times the amount, whether it's synthetic or natural, if she could use such a small amount and have the same effect and it not go through organs? Do you see what I mean? So these warnings are scary, and they should be, because we're not doing it right. The other thing is estrace. The reason I put this one up here to help is, again, everyone's afraid of breast cancer. If you ask half the oncologists, they'll say, don't take any estrogen. The other half will say, you can't, but you can do estrace. Well, estrace is estradiol. It's not even the one that you're low in the vagina. I mean, it's just mind-boggling. It's absolutely mind-boggling, that they just don't get it right for women, okay? And men aren't much better when we get to them. So go ahead, next. So progesterone. So again, progesterone. Here's one where I left it up there. That way it's not too scary. But even if you look, you're like, wait a minute. Even the shape is different, right? So here's where it's natural. Here's where, and what's in our body, even if you're not on hormones, everyone's progesterone molecule looks like this, but then this is what we'll give somebody. And we wonder why there's side effects. So do you see where it just doesn't have to be that complicated? Progesterone's the most important for younger women, because it is absolutely essential for maintaining a pregnancy. It's also the biggest hormone that drops after a pregnancy. First pregnancy, about 25%. Second, 50%. More than 2 children, your progesterone is low. And about 50% of women bounce back 2 to 6 months. Other women do not. It's not postpartum depression. It's postpartum low progesterone depression. Low progesterone affects depression. It affects libido. It affects sleep. It affects moods. Pretty important, right? And of course, it maintains a pregnancy. So progesterone's really important. It increases the breakdown of fat. It protects against endometrial and breast cancer. But it has to be the right form, and it has to be matched to your body. So you're not getting too much or too little, okay? All right, let's go to the next page. So the difference, there are different types again. I am more proactive about bioidentical. I am not against synthetic. There's no such thing as 100% for anybody. Like I said, I've had 2 cases where in both had brain cancer, ironically. pretty bad. But these people recovered from brain cancer. They're still here. And they said they didn't want to live. They felt so bad because they had no hormones in their system. So we had to do something. I mean, can you imagine going through all that treatment and then saying, I don't even care that I'm better? It was horrible. You know, luckily, we found the right set of doctors for me to work with that we could get them better. And they're still alive today and doing well. I'll never forget these two people. Just, it was heartbreaking, you know, because they were young people too. You know, so we've got to realize how much hormones help. These are some of the ones we use in our office. What's happened is with certain licensure, I can get certain hormones now where I don't even have to just get it through a compounding pharmacy, and it's 1/100th of the price. Some young women, if they have to use a little milligram of progesterone, it might cost $32 for 6 months instead of $50 to $80 per month. So I love that things have changed, and you have to certain license to get it. But at least, and again, I have thousands of patients. So if we're able to use these, there are times where I need a compounding pharmacy because you might need a really unusual amount or an unusual combination, but it's not very often now. So it's wonderful that we even have the ability to even give DHEA also in a cream. So if someone's got a lot of GI issues, if they're on a lot of medications, we can bypass some of those systems. Okay, go to the next page. There's all sorts of additional therapies. And the only reason I mention this again is if someone is not comfortable taking hormones, or one doctor saying, yes, you can, another doctor says you can't, we start with the adrenals and we do things that don't ever interfere with hormones. So there's lots of things we can do. But you have to work with someone that knows those choices. You know, otherwise it's going to be take this or this. And it's just not that simple. You really do have a lot of choices. I remember there was a woman that was in one of my son's Taekwondo class. And I mean, she would do Taekwondo. She'd have to go in between and change her clothes. It wasn't just sweating. She almost would pass out. She lost half her hair in 6 months that I knew her. I'm like, oh my gosh. I was just starting in the compounding pharmacy then. And she'd also had cancer as a child. So she was really scared to do any hormones. And I just said, you're already doing exercise, let's focus on your adrenals. And we got her better within a year. So, you know, and now she's doing great, still one of my patients. So, and that was in Illinois. So there are things you can do, but you don't just pick it off the shelf. You know, again, that's where the testing comes in, okay? Okay, let's do the next page. So melatonin, we talked a little bit about it, but I think it's really important because of all this TV stuff and all this advertisement and all this stuff I'm seeing even given young children and even infants I've seen giving melatonin. It is not a good idea. I'm just going to tell you. When you do it right, the average woman I see needs between 1/2 milligram and 5, and you never want to use more than 8, ever. You will absolutely cause problems long term, and I've seen it. And we're talking brain problems, thyroid problems, pituitary problems. I don't care where you're getting it, contaminated or not. So you want to be doing it right. If someone wants to take a very low dose, then I'll do 1/2 to 1 milligram, you know, really small in a sublingual form, not an oral form. The other thing is that it isn't just for sleep. Remember, it's cognitive diseases. It's end of neural pathways. Kent showed yesterday, right, where serotonin, tryptophan, right? You remember all those pathways with the brain? And if you don't have enough here, how it made your inflammatory brain markers high? So it's the same thing. Melatonin is in these pathways with even serotonin and depression and things. So when you start messing with these pathways, it messes with all these neurotransmitters. And if we said the second leading problem with disability is anxiety and depression, it's pretty important not to get this wrong. So melatonin affects metabolism and even diabetes. I mean, I can go on and on and on. So all different things it affects. It also directly is affected by light and other things. So again, why people have so much sleeping and stress at night is because of having the cell phone in their bed, working on computers all night. Put the light away, have a nice dim evening like we are up here, okay? Here's an example about when Kent starts talking about quality and foundation. This is EGA. We always try to give updated. EGA just won the Wimbledon Grass Open. One of our sons is a tennis pro, and we love tennis. So EGA is second in the world, and she got a 1-month suspension. Usually when you get a contamination, a drug test, then you're out for a lot longer, and it's a lot of money. She proved it was from her contaminated melatonin. And it was a bad substance. We're not talking banned just because of any kind of exercise. We're talking dangerous. It's in 97% of supplements you buy. Do not buy them at the store. You can't go to Walgreens and Trader Joe's to get them. They're not the right form, they're not the right kind, they're contaminated with lead, arsenic, all sorts of things, TMZ, and melatonin. Luckily, she proved it, so that's why they gave her 1 month suspension, and everybody on the tour said absolutely. They knew before, she just wouldn't lie. She's just not that kind of person. So luckily, again, it didn't affect her whole career. So supplements in men. So why we start talking about foundation and supplements is they affect every one of your disease and conditions. We had a lot of conversation about it last night, especially after the lecture, because people are taking 50 different supplements. And I just said, it's not good. How do you know what you're taking? There's 10 rules we have when we're talking about quality. And I'm going to give you old data and compelling data. I've never taken a multivitamin. I would never recommend a multivitamin. I never took one even in pregnancy. I said, I'll take any individual thing that I have a deficiency in, but I will not. Because National Cancer Institute, Journal of American Medical Association, 2011, and I can give you a study for every year, years and years. 35,000 men. One of my own DOs was in this study. He said, I pray I got the placebo. I hope I didn't get the multivitamin. Because they showed vitamin E increased prostate cancer by 17% in men because it's not the right food form. Vitamin E and selenium together increased and doubled the risk. You only take separate vitamins and minerals outside of vitamin D, which is a hormone, if you have a deficiency. Okay? And all these podcasters, everyone needs magnesium. How many low magnesiums do we see? Not much. Who said? Where are they getting this from? You know, they're not testing anyone. Yeah, just pulling it out of the air. That's very nice to say it that way instead of pulling it out of here. Or here. Or you say we all have a belly button, we all got that, but we'll keep it clean. All right. Glad Bryson isn't here. This is being his cognitive, you know. So, all right. So again, we know, and that was the National Institute of Health that funded this test. Go ahead. So postmenopausal women and 160,000 postmenopausal women, women who took multivitamins did not prevent cancer, heart disease, heart attacks, strokes, or reduced death. Now, why do you take any supplements? Isn't it to prevent disease and be healthier? Yeah. And I mean, I can give you a study after study. This is a really old one, 2009. I could give you one on B vitamins that would blow your mind. I've had 8 cases 1 year of lung cancer. All women were getting B12 injections. It's not the right way to get B12. You don't want things up and down. You want things the right form and like this. So there are reasons we get sick, and none of them were smokers or ever lived with a smoker, by the way. So, and there are studies that show this. So you're going to see why we're so proactive and so pushy about the foundation. Okay, next. All right, so we're going to turn it over to Kent. He's going to explain more of these. And you're going to see how they, other than one slide that I'll bring in, how it influences hormones and that why we know why the foundation affects brain health for some of you who were there, but now you're going to understand also why it affects hormones. If it hormones, it affects heart health, right? So you're going to keep seeing all these relationships. I'm sorry, I have to go back to help with the, thank you.
Yeah, now you're my tech person.
Yeah, all right, gotta get my glasses on then. All right, I'm ready.
So we're going to start, I'm going to link this back to what Valerie just was talking about. So foundational wise, a lot of people think of a multivitamin as being like, oh, everybody should take it, it's foundational in health, etc. What we recommend instead is these 3 things minimum. So how many of you eat 10 servings of raw fruits and vegetables a day? I don't either. It's almost impossible to keep up. And if you can, that's awesome. What we do to bridge the gap between that is something like the Juice Plus capsules or the superfoods powder that you just mix in a drink and then you drink it. So that way, it's not an alternative for fruits and vegetables, but it does give you access to 30 different fruits and vegetables, the nutrients from those every day, so then you don't miss it. So it's at least something. Fruits and vegetables are important because one study found fruits and vegetables lowered breast cancer risk. So the phytonutrients, those antioxidants in fruits and vegetables, they actually do protect our cells from damage. Number 2 on the foundation would be vitamin D3. 65 to 100 is the optimal range of D3 for a man. 75 to 100 for a woman. This is a super easy test just done by a finger prick. We have it at our office. A lot of doctors' offices do it. Vitamin D, for example, is important because it has an inverse relationship with cardiovascular disease. So low vitamin D increases cardiovascular disease risk, and optimal vitamin D lowers that risk. Third on the foundational support is essential fatty acids. That's the omega-3s. Omega-3s affect hormones. They influence risk of heart disease. They influence risk of brain disease like dementia. And they also are nature's own anti-inflammatory. And like Valerie mentioned before, inflammation is part of the root cause of most, if not all, disease. So Juice Plus, the 3 capsules on the left, we've got the Juice Plus has an omega-2, like I just was talking about omegas. So if you want to plant one, that's a good alternative. It has more than 40 medical studies proving its effects in humans. So this just means 40 studies or more of people eat the actual supplement, or not, I shouldn't say supplement because it's a food technically. People eat the Juice Plus and then they measure things afterward. So it's not just these ingredients are associated with this, it's these people eating this is associated with these benefits. So why are fruits and vegetables important with hormone issues? So these 2 molecules written up top, I3C or DIM, these are chemicals found in cruciferous vegetables, and they block the effects of excessive estrogen. So Valerie spent all this time talking about hormone balancing and how important it is, and this is a natural way to help yourself with that. What are they? These chemicals in these cruciferous vegetables also improve testosterone and estrogen metabolism. If you want an alternative, a supplement with this that we use quite often is the Onco and Tissue Shield. This has some of the chemicals from broccoli and mustard powder that have a similar effect. So, strength training. This is where it gets exciting for me, being a former personal trainer. So strength training and hormone health are like this. They go hand in hand. Everybody needs strength, and it's not just so that you can get up the stairs. Strength training boosts growth hormone. It boosts other hormones, helps you build muscle and bone density. It helps us burn fat. An interesting thing with that, a lot of people think that to burn fat, they need to do a lot of cardio. Cardio is super important, as we talked about last night, for brain health. It's also super important for burning calories. But strength training, getting more muscle on your body, increases your resting metabolism. So this means the more muscle mass you have, the more calories you burn just sitting there, which is awesome. That helps everybody. Strength training also improves insulin sensitivity, reducing risk of metabolic issues. Strength training balances stress hormones like cortisol. Strength training helps maintain testosterone, estrogen, and progesterone. And as a bonus to tie into yesterday's lecture, strength training and exercise in general boosts mood and focus by increasing neurotransmitters and BDNF. So there's really no downside to strength training if you do it the right way. Now, third on the foundation was omega-3s. Omega-3s, the main 2 that we measure are EPA and DHA. And specifically for athletic performance, this study found that EPA and DHA has an anabolic effect. It counteracts delayed onset muscle soreness. It improves endurance capacity, helps us burn fat, better reaction time, better muscle recovery. Skeletal muscle are the larger muscles in your body. And it helps with blood flow after exercise. So that's on top of the anti-inflammatory effects that it has for the brain and the heart as well. And we can't talk about strength training without talking about protein. I'm sure everybody here has heard of protein. You're probably sick of hearing about it. It's a buzzword. It's everywhere. You can't get away from it. But a lot of that is rightfully so. Protein helps us build muscle mass. It balances our blood sugar. Some hormones are made of protein. Insulin, growth hormone, follicle stimulating hormone. Protein supports liver function, which helps us detox, including detoxing excess estrogen. Protein helps us build neurotransmitters, which are the chemicals that are partially responsible for how we feel. This includes mood, stress response, and motivation. These chemicals directly affect how we experience the world, so protein is super important. That being said, 2 proteins that we feel really strongly about. Number 1 would be the Juice Plus Perform, which is 25 grams of protein per serving. It's plant-based, and most importantly, it is NSF certified, meaning it is tested for contaminants after production, so you know you're not getting a bunch of toxic metals and other crap in it. A second alternative we use a lot for protein, myself included, is the Juice Plus Complete. It's low in sugar, it's low in calories, it's low in fat, 7 grams of fiber, 6 types of plant proteins, gluten and dairy free, nutrient dense, and really interestingly, it scored a perfect for the highest rating of quality of a protein that a human can consume. So I wish the Perform had different flavors than berry, because that doesn't really work well with chocolate, for me at least. But berry and French vanilla actually is okay. So I mix those 2 after my workout, and I know I'm getting the highest quality protein I could. As far as additional testing goes, we mentioned essential fatty acids. That's just a finger prick for your omega-3s. DNA genetic oestrogen testing, other genetic testing, neurotransmitter testing is a urine sample where you can measure your mental health markers. Nutrition testing, we have aging, inflammation, and food sensitivity testing. Toxin testing, Valerie mentioned briefly how toxins affect risk of all disease, and this is one of the best ways to figure out what exactly is going on in your body before it becomes a problem. Female and male hormones, a lot of the testing is done by finger prick or by urine or saliva, and that, especially the urine and saliva, it's not typically what you see in a doctor's office, which to me just reiterates what Valerie said before, that figuring out a different way to do it, figuring out what's not working and changing it, this is a good alternative. In conclusion, test correctly. Individualize based on the test. You can't know exactly what to take unless you test yourself first. And then make sure that you have your foundation covered, those phytonutrients from fruits and vegetables. We've got vitamin D3 and the omega-3s. Those 3 apply to anybody in different amounts based on a test, of course. But those 3 apply to anybody, and then anything on top of that is a bonus.